Hi, everyone. Thank you for joining us this morning. It's another in our free series of webinars that we're hosting, running every weekday at 10 a.m. Through May 1st. My name is Brad Mayfield. I am the Director of Business Development for Greater Therapy Centers, and I'm going to introduce Claudia, who's hosting our webinar today, and then I'll mute myself. If you have any questions, you can type in the question box below. We'll do our best to answer questions at the end of this webinar. So I'll be monitoring those. Just type away and we'll be glad to answer. Okay, Claudia attended the University of Arkansas, where she received her Bachelor's of Science in Kinesiology. She then went on to study at UT Southwestern, where she earned her Doctorate of Physical Therapy. Her career experiences include 6 months of neurological experience, focusing mostly on stroke and brain injury, along with some vestibular rehab. Claudia also had 1 year prior of orthopedic experience working with the full range of ages and orthopedic conditions. She has been with our team since 2019. In her free time, Claudia loves to travel to new places, cook and explore new foods with her fiance. As a typical PT, exercise is a huge part of her life. She frequently exercises by weightlifting and or yoga. Claudia is an avid reader and loves anything that can get her outdoors, especially running, hiking, camping, and walking her dog, Luna. All right, I'm going to let Claudia get started, and I will mute myself and be back at the end. Thanks.
Okay, hello everybody. I'm going to start today by talking about kind of things that can occur while working from home, especially as it refers to your low back. So as many of you start working from home and sitting in a new work environment, we're going to kind of go over things that may arise pain-wise in your low back and kind of explain some low back pain, maybe myths and stuff. So we'll kind of go through that. Brad, how do I make it to where I can only see my, like, let me see how I can do this. One second. Okay, we'll just go with it. Oh, perfect. Okay.
There we go.
Yeah, that's Brad. Thank you so much. So objectives that we'll go over is sorry, I gotta move this over. Okay. We're gonna understand the general mechanisms of low back pain, and I'm gonna refer to it mostly as LBP just to make it a little bit easier. So if you see that, that's what that means. We're gonna understand how to make your workspace a little bit more lumbar friendly, implement new ways to introduce movement into your workday, and learn ways to strengthen your core and decrease any low back pain that you might have. So first I want to go over a little bit about kind of the bony anatomy of the low back and the pelvis. So as you see, it kind of starts at, so we call them L1 because it's lumbar spine. So you've got 5 lumbar vertebrae, and in between each of these are what your discs are. So if you've heard about any disc related issues, that's what that is. And then the lumbar spine connects to your sacrum. So you've got the sacrum here and the coccyx, and these are basically fused vertebrae that then connect to your pelvis. And also the coccyx right here is also referred to as the tailbone if you didn't know that. But then the pelvis, of course, connects to your hips. So basically all of this is just really interconnected, which is why a variety of issues can cause low back pain. But yeah, that's kind of the bony anatomy. We'll move into the musculature. So I basically just put these on here to show you how complex the musculature in this area can be. As you can see, there's a lot of muscles that kind of connect from even just the vertebrae of the lumbar spine, even down into the hip. So this right here is your femur, and it can kind of connect down into the hip there. You can see the back view, and all these muscles go all the way up your spine, even into your neck. So there's that, and this is more of the superficial view, so more surface level anatomy of the muscles, and you've got kind of your oblique muscles here. So really vast network of muscles that all work together to kind of support your spine, hips, pelvis, and that also shows you why sometimes people can have, you know, something that's wrong with their hip, but that causes their pain, or the back pain causes hip pain. So we'll go over that in just a little bit, but just take the time to appreciate how complex all of this is, because it does get a little bit intense in there. Okay, so I want to go over a few myths of low back pain, and then we'll kind of move forward. So a lot of people think that bad posture leads to low back pain, that an MRI will lead to a definitive diagnosis of what's going on, that if you have low back pain, you should take it easy or just do bed rest. And then if an activity causes pain, you shouldn't do it. And that's because your back hurts, something's definitely out of place or alignment, or it needs to be adjusted. And those are not necessarily true. And I'll go over all those in just a little bit, but those are just some myths, which might be counterintuitive to a lot of you. Okay, so then let's go into why does your low back hurt then? So basically, it is really rare for you to have a specific spinal pathology. And what I mean by that is that there's a fracture, cancer, spinal infection. That's less than 1% of things. So, and the majority of this less than 1% is a fracture. And that happens more with people with maybe osteoporosis or like car accidents or something that's really traumatic. So these are really rare. So if you do have low back pain, I wouldn't immediately go to thinking that you've got any of this. There are ways that we as PTs differentially can diagnose this a little bit, but if we do find anything that might be cause for concern, we would refer you out to another doctor. The next 5 to 10% goes to radicular symptoms. And what that means is that there is an insult to the nerve, and that will cause referred or radicular pain down into the leg. And so spinal stenosis, you guys have probably heard of a lot. Disc pathology, so like a slip disc or I don't know, disc disorder, and then radiculopathy. So a lot of this can just be caused by, it's more of a mechanical issue, and that's really not even 10% of cases. And with the 10%, we do have, obviously, as PTs too, we have ways and tests and a battery of special tests, we call them, to be able to diagnose that. And we do like deep tendon reflexes. So kind of when you get your like kneecap kind of hit, that's a way you can tell. We have like sensory changes that could happen with that. Weakness, so we test your muscle strength. So if you don't really see any of that, if you don't have any like significant numbness, tingling, or weakness down into the legs, it might not be a true radicular symptom. It could just be a referred pain, which is a little bit different. So the good news is that like 90 to 95% of low back pain is nonspecific, which means that it's probably just musculoskeletal, but there isn't really a test to specify where that pain can come from. And that's not to say that, you know, like it's not saying nonspecific in the sense of your pain is not specific, because pain is always specific and it's always very valid and real, but it just means that it's not coming from a thing that we can pinpoint anatomically or through imaging per se, okay? So the things that you should know about low back pain is that it really is multifaceted. It can be driven by a variety of factors. So like your physical conditions, social factors, psychological factors, things like abnormal sleep and life stressors, and what else? Like even negative beliefs about how you can perform your day-to-day activities can affect your low back pain, which seems crazy, but it's true. And so that's why it's really hard to kind of treat it in a sense of like getting in there and being like, well, this is what's wrong. This one thing is going to be the treatment for it. So you kind of have to be patient with it, which nobody really wants to hear, but patience is a virtue. The good thing about nonspecific, what I said earlier too, is that it just means that it's nothing serious. So like I said, the 90 to 95% of back pain is nonspecific. So it's something that can't be differentiated on an MRI per se. And also, MRIs are not the best for diagnosing a specific low back pain. So if you do have like that if you're in that 10% where you have the stenosis or like really big narrowing into the spinal cord, like that's a really great time for an MRI. But if you have low back pain that doesn't really cause any of those, like that weakness, that numbness, that tingling, then the MRI might just give you a little bit of false negatives, false positives. So what I mean by that too is they did a lot of studies about people who, you know, don't have any back pain, and then they get MRI studies, and it's like, well, you get narrowing, you have narrowing here, here, a little bit of disc compression, and then it kind of almost makes you think, well, oh, well, my body's broken, so I obviously have to have back pain. And I'm sure I would have MRI findings as well, and I don't have any back pain, so it kind of is, it's definitely a double-edged sword because it can be a really good diagnostic tool. And then the next thing is that back pain is totally normal. So 20% of people are likely to get some each year, and about 80% of us will get some in our lifetime. So it's almost unlikely that you would not get back pain. It'd be more abnormal for you not to than to get it. And also it's back pain. The problem with back pain is that it really is the same as hip pain, knee pain, shoulder pain. We're just a lot more cautious about it. And I think the reason for that is that because the back is so close to the spine, right, and the spinal cord. So we get scared because, you know, you think, well, if my back is broken, then everything else is wrong. And it's so close to your nerves, and nerves are scary. And I totally get that. But a lot of times too, it's just an irritation or an inflammation. And that actually can be a good thing because it means that your body's trying to fight it and your body's trying to recover. So it's not necessarily a horrible thing to have a little bit of inflammation or irritation as it results to back pain or just anything in general. Non-specific pain responds really well to movement. So like I said earlier, one of the myths was that you almost feel like you can't do anything and that you should be on bed rest and lay down and kind of rest, which is, there's definitely time and place for that. But your body craves movement. We as PTs are corny and like to say motion is lotion. And I also like to say that movement's improvement. So take that as you may. But the good things about movement is that it really does increase blood flow to the area, which can help like increase those anti-inflammatory processes if that is what's going on there. So when you're just laying around, it's like you just let the thing sit there and fester instead of really doing something about it. So movement is a really, really, really good thing about back pain. I'll go over some ways to kind of introduce that into your day-to-day life in a little bit. And then the last thing that I'd like to say is that your back pain is more than likely not caused by your posture, your muscles not firing, or something being out of place. So a lot of people also think, and because we're talking about ergonomics and all that, a little bit about, you know, we're going to go into that in a second, but your posture isn't as bad as what we originally thought. There's been good research saying that it's not bad posture, it's sustained posture. So what I mean by that is you staying in the same hunched over position for hours and hours and hours is the reason that you're hurting, not the fact that you're in this position, if that makes sense. So if you're in this for 20 minutes and then you kind of move and open up a little bit and kind of go back and forth with that, the 20 minutes spent in this position is not harming you as much as what we originally thought. And there are, you know, we have a bunch of other webinars that have gone on about like your neck position and stuff like that. And it's all, go back and listen to those because they're really good. But it really isn't, it's just the sustained posture of it. So try to move. Like I said, movement is improvement. So let's go to the next one. And I think this is going to be about adjusting your workspace. Yes. So a few ways, and my coworker Devin Johnson, he did a whole webinar about this last week, I think. It's on our YouTube channel if you want to go check it out. I'm going to go quickly just through this as it kind of refers to low back pain, because he did a whole thing about setting up your workspace and it was really great. So if you need a little bit more information, you can totally go watch his. So one thing that you can do, because a lot of us don't have the ergonomic chairs, obviously, so we probably sit in something a little bit more like this right now, unless you are lucky enough to have a home office and with a really nice chair like this. But one thing that you can do, most ergonomic chairs have a little bit of a lumbar support right here. So putting a towel roll or like a rolled up blanket or a small pillow that you can kind of fold in half right at the small of your back can kind of help tilt your hips forward a little bit, put that nice curve into your lumbar spine and kind of support it a little bit better. Another thing too is propping your legs up on a box or step stool. Again, many of you might be working at your kitchen counter or your bar, and bar stools tend to be a little bit taller, so it's hard to have your feet touch the ground and kind of sit in this really nice 90-90. And if your bar stool's tall, you're probably trying to put your feet up on the little footrest that's underneath it, so you're end up putting a lot of strain kind of in that knee joint as well. So if you can find like a step stool or a box or stack up books or whatever you can to kind of give your legs this position, it will help offset some of the pressure that goes through. And our body works in the kinetic chain. And what I mean by that is sometimes what happens at your ankle can impact what's happening at your hip, or what's happening at your knee can impact what's happening kind of up here. So if you align, I don't want to say align, but if you kind of make the environment work for yourself to where there's not increased strain somewhere that can increase strain somewhere else, it'll be better overall. If you can maintain the 99 position with your hips and knees is what I was saying there. And then support your arms with armrests if you can. Sometimes that's a little bit hard, but if you can't support your arms, then take some time to just really let your arms move, do some stretching. Danny, another one of my coworkers, actually my boss, did another webinar about kind of stretching and upper body kind of easy movement kind of in a chair too. So if you want to go back and look at that one's really good. And then the last thing is changing positions frequently. So what I said is that sustained posture is what we don't want. So if you stand for every 10 to 15 minutes every hour, that'd be really good. If you do have an adjustable work desk, which you probably might not right now, but if your bar stool is tall enough or your bar is tall enough where you can stand at it, do that every, 10 to 15, or do that for 10 to 15 minutes every hour. You can also, if it's comfortable for you to sit for a second, for like 20 minutes at like change a chair or something, do that too, because it just is better not to be in one position. So I think what we're gonna go over next is, ways to loosen up your back and kind of some exercises. So we're gonna go through them, I'll explain them. And they're pictures, so it's kind of hard to see the actual movement, but I'll explain them best I can. So the next two slides are going to be ways to kind of loosen up your back. And what I mean by that is just to add some good range of motion into that low back. Range of motion that you might be scared to do standing or sitting. But these are really great, just gentle stretches that you can start doing. And you can do this before you get out of bed in the morning too. So start your day off with a little bit of movement. The first thing is this lumbar rotation. So if you lie on your back and kind of put your knees up with your feet flat on the bed or the table or whatever you're going to do this. Well, I guess maybe not the table. We use tables in clinic, so I'm used to saying that. But if you just rotate your legs kind of back and forth really gently, and odds are you might not be able to get all the way down to the bed, but just move, even if your range of motion, your arc of motion is right here, that's better than nothing. You're getting really good rotational, your spinal segments are being able to move a little bit, you're increasing blood flow there. That's a really good one. I love doing that stretch. The next one is knee to chest. So if you kind of start the same way that you would start this with your feet flat, then you can kind of bring your knees in gently to your chest, stretch out that low back. Also, if this is a little bit too much for you, you can leave one foot down and just do one leg at a time. This could be a little bit aggravating for you. And if it is, just go with the range of motion that you want. And if this doesn't work for you, then it doesn't work for you, and that's totally fine. This is not a universal, this is going to be amazing for everybody kind of thing, but they're just really good exercises. The next ones are, and these might be a little bit more intense, but if you're scared to get on the ground, you can always do it on the edge of your bed. It's kind of easier to get onto all fours onto your bed. It might be a little squishier than maybe you'd like for support wise, but it's less scary to get into all fours on an elevated surface instead of getting down on the ground if you have a fear of doing that. So the first thing is a child's pose. So these both, you'll start kind of on all fours. And the next, for the child's pose, you're just gonna shift your hips back, straighten your arms out. And this is a really good full body stretch. So with your arms up, you're kind of stretching that lat, the big muscle that kind of runs from about right here all the way up into your arm. And then you're also giving that low back a good curve. This is a really good one. Also, you don't have to go this far down if you don't want to either. So you could, go halfway and then come back up. The next one is a cat-cow. So this is a cat, I guess, because they do this when they're angry, even though it's supposed to be a relaxing pose. And this is a cow, because I guess this is how they moo. I'm not sure. But this is a really good way to start isolating your back movement. A lot of people with back pain, we've noticed, can't really, I don't know how to say this. They can't isolate just the, isolate just the movement in their back. So that's almost like you'll start using your hips or your knees and even kind of your shoulders to start moving instead of just really using that curve in your back. So with this, you're going to try to arch your back and kind of tuck your tail under. And with this one, you're almost going to just arch your back, kind of give that a good curvature going upwards. Okay. And you can kind of alternate back and forth. In yoga, they do this a lot if you take yoga, and you breathe in and breathe out. And I might be saying that wrong because now I know when I do it, but you just make sure the movement can follow the breath, just so you're not holding your breath, because it's not the best to hold your breath and increase pressure in your system. So make sure you're breathing while you're doing all these, because sometimes stretching can make everyone just tense up and hold their breath, which is the exact opposite of what it's supposed to do. So there are a couple ways to just loosen up your back, add some movement into your day before you even start your day. So there's those. The next is about strengthening your core. So these are just a couple of exercises. These are not all encompassing. I think I have 4 of them on here. They're just a good way to get you started. The first thing is called a bird dog. And this right here is the starting position. This is phase 1, or an easier beginner's version. This would be phase 2. So all you do is alternate for beginners, you alternate your legs out. So you're trying to keep a really straight lumbar spine here. You kick one leg out and then you would switch, put this leg down, kick this leg out, right? The next phase, if you feel really comfortable and stable with this, is to do opposite leg, opposite arm. So here she has her left arm lifted, right leg lifted. And with this, you're still trying to keep a good straight back and try not to roll your body too much. And this is a really good balance exercise too. So if you feel like your balance isn't so great, try this exercise. It'll really challenge you. Again, breathe through this one. And for the strengthening ones, start with 10 and then go from there. As you get stronger, you feel more confident in it, then you can increase your reps. But start low, it'll still be good movement. The next one is an alternating march, and the picture here isn't exactly how I want it to be, because what I want you to do is contract this core a little bit. So what you're going to do is squeeze your belly button into your spine, kind of like you're, for lack of a better word, holding in, like, I don't know, just kind of tightening your tummy. And then this would be your starting position, and you would only lift one leg at a time. So this other leg would be down. So alternating lying, marching. So I want you to have both legs down to start, then alternate lifting, keeping that contraction in your abs. You'll feel it more than you think you will. It looks like it'd be easy, but it can be a little bit difficult. So again, start with 10. Make sure too that you're kind of keeping a flat back too, so that it doesn't like lift up. That way you're really contracting that core. The next thing are bridges. This is really, really, really a good exercise. It targets your low back, your glutes, your hamstrings. I will say with this though, you can get a little bit of a hamstring cramp, and that happens a lot if you put all of your weight in your heels. So if you kind of think to shift your weight a little bit more into your toes, kind of, or through the whole foot, you won't cramp your hamstrings. When you put more weight into the heels, it activates the hamstring a little bit more. This too is a really good exercise. I usually tell my patients to squeeze their glute, so that their glute is a thing that's kind of initiating or being more activated during the movement, just so you don't overuse the hamstring or maybe the low back muscles. But I should have said this earlier too. So in your core is inclusive of like your low back, your glutes, the front of your hips, and your abs. So it's not just your abs, just for future reference. So it's kind of everything. So this is a really good way to kind of target that whole backside of your core. And again, start low, do 10, and then see how it goes. Last thing for strengthening your core is hip strength. So day-to-day activity, we do not do very much side-to-side movement. Walking, biking, sitting, it's all pretty linear, forward and back, right? So our hip, we call them abductors, the muscles on the side of your hip that kind of help you kick your leg out to the side. Those can be a little bit weak or maybe just not used as much. So doing things to kind of add lateral movement into your day or strengthen your hips or the side of your hips is really good and beneficial, and will help support kind of that whole core. And so this is a really good exercise. It's basically just a side lying leg lift. If you need a little bit more balance, because it can feel a little bit weird, you can bend the bottom leg up just for a little more balance, and then you just lift and lower this leg a few times. Full disclosure, the lever arm of your leg, which means kind of the length of the arm that you're lifting from the pivot point right here, is pretty long. So your leg it's heavy. You don't need a lot of weight for this. You'll probably do 10 and just be ready not to do anymore. And it's totally normal to feel it in the other hip too. So I get that question a lot. You'll feel it in both hips when you do it, but definitely do both sides. The next few slides are ways to add movement into your workday. So the first thing when you're sitting in a chair is just to do some pelvic tilts. So basically it's like a seated cat-cow. So you're just gonna almost roll forward like you're arching that back, kind of rolling back. And I don't know if you guys notice those like sit bones that we call them. You can kind of feel them if you're sitting on a bonier chair. Kind of roll off of those, arching your back. And then the next thing would be to roll onto it, tucking your tail and almost like curving that low back. So it's pretty much the exact opposite, or the exact same thing as a cat-cow and on all fours, just sitting. So this is a really good way. I mean, you can like literally be typing away and just doing a few of those. So that's a really good one to start doing it just during your workday. You could do it, every 30 minutes or so. You could just do a few of them. The next thing is a figure 4 hip stretch. Some of you might not be able to get into this position, which is fine, but this right here, the way that your hip is bent, it kind of stretches out what we call a piriformis muscle, which sometimes can cause, it can be tight enough to where it can cause sciatica. And my coworker Miguel is going over this tomorrow, sciatica, so he's going to go over it even more. So tune into his. But this is a really good stretch for it. You basically just cross one leg over the other, and then you can either stay there if that's a good enough stretch. You can push your knee down for another stretch, or you can always lean forward. So she's leaning forward a little bit. The more you lean forward, the more you'll feel it. But this is a really great stretch. And the last one here is a hamstring stretch. So getting the back of that leg. So you'll scoot forward to the edge of your chair, straighten your leg out, and just lean forward, keeping the knee as straight as you can. You'll feel a pretty good stretch back here. And these two, I would maybe hold for, I don't know, a count of 10 to 15 a couple of times, alternate legs every time. And it'll be a good way to stay seated, and so you don't feel like you're not being productive during work, but you can add a little bit of stretching or movement in. The last way to add movement into your workday is to take a walk. So for my patients with back pain, I always tell them that walking is kind of one of our best mainstay treatments. If you think about it, when you're walking and you have to be erect, your whole core has to work to basically keep you upright. And it doesn't feel like a core workout, but it is. It's all really gentle. It's all those endurance muscles that are working. So the ones that are fired, they're on for a long period of time at a very low rate. So walking kind of helps strengthen those. It's also really good. Earlier I talked about kind of the psychological factors of low back pain. Walking, especially outside, I mean, especially on a beautiful day, it really does help decrease stress. It can help increase your, the clarity of your mind. It can, exercise increases endorphins and just overall makes you feel better, which is why so many people really do like to exercise. And the people that don't sometimes are just scared of it. So try going on a walk, even if it's 5 minutes. Go outside, get some vitamin D, and I think you'll feel a lot better after, if not physically, mentally. So I say for every 2 hours sitting, take a 10-minute walk. And if you can't do that long, do a 5-minute walk. Go walk around your house a few times, or go walk outside into your backyard and come back in. And then another way now, and kind of when you go back to work into the office, set aside time to walk during your lunch break. If you really say, okay, during lunch, and obviously in Texas, if you are listening from Texas, which most of you probably are, it gets really hot in the summer and it's impossible to go outside during lunch, but you can try maybe, while the weather's still nice, go outside and take like a 20-minute walk during your lunch break, after you eat, before you eat, whatever. So that's a really good way to increase some movement. And then you feel a little, especially if you have a Fitbit, you don't feel so lazy, because then you, at the end of the day, you don't have like 2,000 steps. I think that is it. So if you like are curious about what you heard and you just want more information, or you feel like you would need maybe a little bit more specialized care, or you want like a home exercise program that is kind of tailored to you, because obviously all of those were just very general exercises, feel free to contact me. You can email me at cgorgy@gtc-pt.com. This phone number is our clinic number in the front. And we do have telehealth now, so you don't have to come into the clinic. I know with COVID, it's a little bit crazy to even go to the doctor, but we do have telehealth. We can do online virtual kind of assessments. And then you just get, you know, more specialized, tailored care to you. But yeah, if you have any questions, please don't hesitate to reach out. And I think that is it for me, Brad. So do what you got to do now.
Yeah, thanks a lot. I really appreciate it. Great information. Like Claudia said, we have telehealth available. We're doing these webinars every weekday at 10 a.m. You can hit the our Greater Therapy Center's Facebook page and find the registration information. All the videos are going to be up on our YouTube channel as soon as they are completed. So this one will be up later today if you want to review or share it with someone. Otherwise, thank you so much for joining us, and we hope that you will check out our webinars in the future. Thanks.